Hi again. So we're still continuing with burns. Okay, so again, these videos are meant to be 5 minutes just to enhance your critical thinking. So we've already established the electrolytes that we're looking at when it comes to burn. Okay, specifically sodium and potassium, but magnesium and calcium as well. So one of the first videos I mentioned that the severity of a burn will base on the location of the burn and maybe the patient's age and other comorbidities like what is their medical history and stuff like that. So let's talk a little bit about locations of burns. Okay, so burns that if a patient has sustained a burn around the face, the mouth, the neck, okay, so as a nurse critically looking at this patient, what should you be worried about? Respiratory. Okay, be worried about respiratory issues and sometimes maybe a carbon monoxide poisoning. Okay, for carbon monoxide poisoning, you will notice that the patient might have like bright red lips. Okay, like cherry lips is just like very bright and red lips, cherry lips and stuff like that. And then the skin might look a little bit red. Okay, for if they've had any kind of carbon monoxide poisoning, and of course that is affecting the respiratory system. So again, locations of burn. Okay, the severity of the burn will be based on the location. Where is the burn? Okay, so if I see a burn anywhere around the face, the mouth, the neck, I'm worried about respiratory issue. Okay, if a patient was in a fire in a situation where there was a burned building and the patient was inside, they probably could have inhaled smoke, and then they'll have respiratory issue. But then be mindful that for inhalation injuries relating to burn, right, the first 12 hours your patient may show zero symptom, so they look like they're fine, but then after 12 hours now we start seeing respiratory issues. So if you have a patient that is admitted for, say, they were rescued from a fire, okay, so we can just keep them on observation. You're monitoring them, but know that if they did inhale some kind of smoke and their lungs have been affected because of that, when you start getting to your 12-hour mark, you will see they'll start developing respiratory issues. Sometimes they'll be short of breath, they feel like they can't breathe, they feel like they don't have enough air. So again, location of burns: face, mouth, nose, neck. Those are burns that you want to monitor respiratory status very closely. Then if a patient, if there was any kind of carbon monoxide poisoning involved, you'll see the lips will be really red, like cherry color lips and stuff like that. So just then if a patient, any burns that will cause some kind of disability will be burns that are affecting like limbs, like of course eyes. So if a burn, if there's a burn that involves the eyes, then of course they might end up being blind or something like that. That's a disability. Burns that have affected hands or fingers or legs, those will at the end of at some point will probably cause disability for your patient. And then some there are some burns that the healing process is very slow. So if a burn is anywhere around the ear, and I believe the nose and the ear, the healing, they have healing issues like delay healing and all of that. For patients that will have compartment syndrome, will be patients that have had maybe full thickness burn. And again, what is a full thickness burn? That is the stage 3 burn. So those patients sometimes they can end up with like compartment syndrome and all of that. Then infection burns around the bottom area, the peri area. Those are the dirtiest part of the body, right? Peri, bottom and stuff like that. So those are areas that has high levels of infection. So for infection, we're looking at the peri area. Again, this is meant to be very brief, helps you to promote your critical thinking. As you watch these videos, when you get to those questions, you'll be able to critically think to arrive at the good answer or the best answer for the situation or for the case study. The severity of the burn will depend on the location of the burn. Give an example of respiratory issues with burns around the neck, the nose, the mouth, and of course maybe the chest area too. So that's where your trachea, your respiratory tract is. So we watch out for that. And thank you, and I'll see you later.